الزميل العزيز الأستاذ الدكتور أسامة عرفة على الدعوة الكريمة، وبنبقى سعداء إن احنا نحضر المؤتمر العظيم بتاعه كل سنة. ويسعدني ويشرفني إن أنا أقدم الأستاذ الدكتور نادر فصيح هي محاضرة أونلاين هيتكلم على الفانكشنال كف.
معطينا واحدة من ثلاث.
بسم الله الرحمن الرحيم. طبعا في منتهى السعادة ان انا اكون في المؤتمر مع الاستاذ الدكتور أسامة، الاخ الكبير العظيم. المؤتمر اللي انا ببقى حريص ما بيمنعنيش عنه غير الشديد القوي. موضوع النهارده اللي هتكلم فيه عن الفانكشنال كاف او سب تايتل منه سوماتيك كاف سيندروم. احنا كلنا عارفين ان الكاف is one of the most common complaint for which patients seek for medical advice. And the most common reason for general medical consultation. We have a wide range of differential diagnosis of cough, especially chronic cough. But actually we have many cases of chronic, dry, unavoidable cough. And if we have no reason or explanation for the chronic, dry, unavoidable cough, this is what is termed functional cough. And about some cough syndrome is one of the causes of the functional cough. The objective of these presentations is to discuss in short cough definition, classifications, and approach for diagnosis, and then to pass to an interactive case presentation of somatic cough syndrome, then the differential diagnosis of somatic cough syndrome, and the last point is management of somatic cough syndrome. As we know that cough is a rapid ballistic movements which have a very important importance for all of us. There are two main importance of cough is the clearance of the airway secretions. Which of which is more important? The most important criteria or importance of the mechanism of cough is the prevention rather than clearance of secretions. And we can classify cough according to the duration into acute cough, prolonged protracted bacterial cough, chronic cough, and we have other definitions. But the classifications of cough, whether acute or prolonged acute cough or chronic cough, but the American College of Chest Physicians, the Thoracic Society of Australia and New Zealand, and Canadian guidelines, German guidelines, and most of the European guidelines reported that chronic cough, when cough persists more than 4 weeks, and acute cough less than 2 or 3 weeks, and the prolonged protracted cough is which more than 3 weeks, which is termed as protracted acute cough or prolonged acute cough. However, this terminology, it means that we have usually in prolonged acute cough which persists beyond 2 or 3 weeks and relentlessly progressive, and it is not reached up to the duration of chronic cough. We have 4 main reasons: either tuberculosis, foreign body aspiration, or a mucus plug or mediastinal mass which causing compression on any of the airway, and also whooping cough. Chronic cough, in which cough which persists more than 4 weeks of duration, we have 2 main reasons: either specific and non-specific causes. The specific causes in which we have by clinication a specific cause, and so you can reach a diagnosis like cases of asthma, foreign body aspiration, gastroesophageal reflux, chest infections, whatever the etiology. So this is the specific cause of cough. But the term non-specific, in which we have absence of identifiable respiratory disease, either by history, clinical examination, and investigations. So this is what is termed non-specific cough. However, non-specific cough represents about 50% of the causes of chronic cough. And if we consider that chronic cough in pediatric age, especially in adolescents and school-aged children, represents about 13% of the childhood of children at that age. And if we're considering that we have about 28 million of children below the age of 14, so we have about 3.75 child each year in Egypt with chronic cough. The algorithm of how to assess patients, the history, clinical presentation, physical examination, and we can identify symptoms and signs suggestive for specific disease, and whether this cough is dry or wet. And so you are doing all of these. Either you have symptoms and signs specific for disease, like cystic fibrosis, primary cystic dyskinesia, bronchial asthma, aspiration, reflux, foreign body aspiration, infection, tuberculosis, pneumonia. So in this situation, you reach it and a cause at that age. And if you have no symptoms or signs or even investigations specific, so you can classify this either wet cough and dry cough. So if you have wet cough, you should search for the causes of wet cough, like idiopathic bronchiectasis, and if you have dry cough, so this is what we can term that this is the functional cough. If we ask ourselves an important question about the causes of chronic cough, if we ask what are the most common causes of chronic cough, however, this is a wrong question, because this should be associated with the age of the patients, because the common causes of cough differs according to the age. And as we can see here, in preschool aged children, airway infection, anomalies, foreign body aspiration, and the protracted bacterial bronchitis are the most common causes of chronic cough in preschool aged children. However, these causes are not common in school aged children or adults. And however, upper airway cough syndrome, asthma, eosinophilic bronchitis by all of its terms, and vocal cord dysfunction, and all in adolescents and adult children. This is an example of a child which is so we can see a 12 years old boy with chronic cough for more than 8 weeks. So it is a chronic cough. It is honking in nature, interrupts his daily activity with frequent school absenteeism, and also with normal clinical examination and normal auscultatory chest findings. He had many visits for many doctors, even ENT doctors, with many medications, including ICS for 6 weeks without any response. He had complete disappearance of this chronic cough once asleep. However, this is what we can term before psychogenic cough. The typical characteristics of psychogenic cough, as we termed it before, which is dry, sharp, short cough, which is honking in nature or barking in nature. It may be precipitated by upper respiratory tract infection, and what is very unique for its type is the complete disappearance of this coughing once the patient sleeps. And usually these patients have normal clinical examination, and he received many medical medications before and many doctor visits before without any response. And usually the age of that patient is between 8 and 14 years of age, but it may be a little bit younger than 8 years. So it's starting from 4 years, but this is the peak age incidence. Usually the patients get profits from this type of cough. He may get attention of his parents, may get school absenteeism, and this is usually what we say the psychogenic before cough. But actually, the American College of Chest Physicians changed this term psychogenic cough into the term somatic cough syndrome. Why they confirmed it into somatic cough syndrome? Because these patients usually have a psychological disorders. And this type of cough is a sort of somatization of this psychogenic distress into physical symptom. So that's why we termed that this type of cough is a somatic cough syndrome. As we can see here, the peak age incidence is between 4, but it is very limited number of patients, and increasing with age, and the peak between 8 and 14 years of age. And it is a chronic type of infection, as we can see here, the durations of cough lasting extending between just 1 month up to 12 months in some situations. We have many differential diagnoses of patients with chronic dry cough, barking in nature like that patients, like asthma, cough variant asthma, atopic cough, non-asthmatic eosinophilic bronchitis, whooping cough, tracheomalacia, post-infectious cough, vocal cord dysfunction, exercise-induced laryngeal obstruction, Tourette syndrome or Tourette disorder, and also the structural anomalies of the supraglottic, glottic, or subglottic regions, or even the extratracheal part. This is another example of a patient. You can see these sounds. The mother is complaining from chronic cough since more than 3 months. They visited many doctors, ENT doctors with many medications, but all of them fail without any response. Clinically is completely free, physical examination is free, normal X-ray chest, and this condition worsened during stress and doesn't disappear during sleep. So actually, this is not a cough. This is just sounds. So what we say, this is the Tourette disorder or Tourette syndrome, or what tick, cough tick, which is not definitely psychogenic cough or somatic cough disorder. But actually in Tourette syndrome, controllable, even motor disorder like eye movements or eye or mouth movements like that. Or we can get also vocal tics in which we have sudden uncontrolled vocal sounds. And these sudden uncontrolled vocal sounds may be grunting, barking, tongue clinking like that, sniffing, hooting, saying rude things, or throat clearing, hissing, spitting, whistling, or squeaking, or gargling, or echoing sounds or phrases repeatedly at this type of patients. In Tourette syndrome, usually this is occurred during sleep and doesn't disappear during sleep. And so that's why this patient have no true cough, but actually a vocal cord Tourette syndrome. Boy coming with back history of repeated attacks of hoarseness of voice with difficult breathing, barking, cough, stridor, and chest tightness, which required frequent PICU admissions with frequent intubations. Once intubated, there was no normal airway pressure and no auto-PEEP for the patients. Once intubated, soon the patient was normal. He received ICS for more than 6 months, but by proper technique without any response. And this is the normal X-ray of that patient. Actually, this patient is suffering from what we say vocal cord dysfunction, in which the patient has difficult breathing, chest tightness, stridor, feeling of choking or suffocation, frequent cough, which is barking in nature, voice changes and hoarseness of voice. And actually, vocal cord dysfunction is a little bit difficult to estimate. And we have many literatures about the prevalence of vocal cord dysfunction. Some of these said that it is maybe so for dyspnea are suffering from vocal cord dysfunction. And vocal cord dysfunction actually an upper airway. Simplified diagnostic criteria for patients with atopic cough, which is one of the differential diagnoses of the functional cough, is that we have dry cough lasting more than 3 weeks without response to bronchodilators, and we have any findings suggesting of atopy like skin prick test positive, specific IgE is positive, total IgE is high, peripheral eosinophilia, and even his past history of atopic dermatitis or food allergy, something like that. And this type of coughing is usually relieved by receiving antihistaminic, especially histamine 1 antagonist or steroids. And however, exhaled nitric oxide may be high in these patients, and the bell eosinophilia is absent because bell is a peripheral, and this type of cough is usually due to proximal airway eosinophilia. The non-asthmatic eosinophilic bronchitis is one of the common causes of chronic dry cough in adolescents and older children. However, this type of cough is due to chronic cough, is associated with chronic cough without any results to response to bronchodilators. We have also normal airway hyperresponsiveness, so negative challenging test, and normal X-ray finding, but sputum eosinophilia is one of the very important issues in which we have greater than 3% of the sputum, whether this sputum is a sputum or induced sputum. And bronchoscopically, we can find how we have a chronic inflammatory airway and goblet stoning of the tracheobronchial tree, as we can see here. Another example of the functional cough is the cough variant asthma, in which we have chronic cough lasting more than 8 weeks without any previous history of asthma or recurrent attacks of wheezes before, no past history of upper respiratory preceding that, also no history of upper infections. Increased airway hyperresponsiveness is important, effective response to bronchodilator, no increase in cough sensitivity, and no abnormal finding on X-ray. If we pass rapidly to the differential diagnosis of patients with chronic barking cough in nature, which is the differential diagnostic points for patients with chronic dry cough, in which we have the same as functional cough, or what we say functional cough. This is an example of cauliflower mass, you can see here, obstructing the inlet of the larynx, which is laryngeal papillomatosis. And this is also a mass in the supraglottic regions, compressing the or obstructing the inlet of the larynx, which is due to retention cyst. This is another patient with 2 retention cysts in the subglottic regions. This is another patient with vocal cord nodule on the right side. This is a patient with metallic foreign body in the subglottic region. And this is a patient with tracheal bronchus, in which we have the opening of the right upper lobe bronchus arising from the trachea and suffering from tracheomalacia. This is another patient with what we say laryngeal clefts. We can get folding of the esophagus in the posterior wall of the trachea, causing obstruction and causing recurrent barking, cough, and also respiratory symptoms. This is a patient with right laryngeal cord tear, and again another tear of a right laryngeal cord due to difficult intubation and the traumatic intubations of these patients, and these patients suffering from chronic barking cough. Another patient with subglottic stenosis, and this is another patient with infiltrating tumors in the trachea extending down to the left main bronchus. This is another patient with what we say innominate artery compression, can cause tracheomalacia and compression of the anterior-posterior wall of the right-sided trachea, and this patient is suffering from tracheomalacia causing chronic barking cough with recurrent chest infections. This is a patient with subglottic mass in the left posterior lateral subglottic region. This is hemangioma. This is a patient with tumor rhabdomyosarcoma in the trachea causing near obstruction of the tracheal lumen. Also another mass infiltrating the submucosal region of the trachea, causing nearly about 85 to 90% of a tracheal narrowing, causing recurrent barking cough. This is another patient with lingual cyst causing overriding the epiglottis here, as we can see here, and causing down displacement of the epiglottis on the glottic orifice and causing recurrent barking cough with difficult breathing. This is patients again with membranous tracheitis, an extensive form of extensive crusting, yellowish membrane, and severe inflammation and edema of the tracheobronchial tree due to either methicillin resistant staph infections or Pseudomonas or Klebsiella or Proteus or Streptococcus pyogenes or multi-resistant streptococcal infections, Streptococcus pneumoniae. Again, sometimes laryngeal foreign body like coin, we can see here, can cause also tracheal compression, causing respiratory noises, chronic barking cough, swallowing difficulties. And these another patients with mediastinal mass like bronchogenic cyst, causing tracheal compression and causing recurrent barking cough. Again with laryngeal cleft. This is the last case with case scenario, 10 years old female with recurrent attacks of difficult breathing, barking cough with hoarseness of voice, and usually following exercise, and chest examination is normal, X-ray is normal, and this is what we say exercise-induced laryngeal obstruction. However, this type is definitely similar to vocal cord dysfunction, but usually developed after exercise. However, this is a common condition among adolescents and young adults. It is not a rare condition, and misdiagnosed usually by asthma patients or misdiagnosed as an exercise-induced asthma. Exercise-induced asthma. The clinical presentations is dyspnea on exertion, stridor, difficult swallowing and difficult breathing, non-productive cough, which is barking in nature, with hoarseness of voice, chest tightness, and this is usually following exercise. The major important way of treatment is, major element is what we know as suggestive therapy for treatment of somatic cough syndrome, or what is previously termed as psychogenic cough. Actually, when you have a child with psychogenic cough, the main item is either to try with suggestive therapy. First is to try to explain that for that patient that this is a not serious condition and this is due to stress or something like that, and try to avoid his attention or shift his attention to something else. So if you succeed to ask the patients when he had the desire of cough to get counting 1, 2, 3, 4, 5, and then to cough. And then after the second attack, when he have the desire of cough, to stop coughing and to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then to cough. So you are succeeding to stop the desire of coughing by shifting it to counting or something else. And then to count more up to 15, to 20, to 30. So if you succeed for stop the desire of cough for a high counting like 50, 70, 80, this is the start of stoppage of this psychogenic or what we said somatic cough syndrome. And for treatment of exercise-induced laryngeal obstruction, speech therapy may be needed, inspiratory muscle training, relaxation and psychological support may be needed, sometimes therapeutic laryngoscopy during exercise, or may need in some situations supraglottoplasty for refractory diseases and non-standardized therapy. In some situations, botulinum toxins may be needed for treatment and the treatment for comorbid disorders. And lastly, to take home message, we are in need to increase the awareness of what we term functional cough as a non-organically caused symptoms in children and adolescents. The means of diagnosis of a functional cough based on the distinguishing characteristics of this cause of chronic cough away from other causes of chronic dry cough, as we discussed in these presentations. And the last point, we should understand the principle of treating functional cough with a simple behavioral technique called suggestive therapy. And thank you. Many thanks for all of you, and I hope to be with you in the next year إن شاء الله بإذن الله. Many thanks. وتحياتي الطيبة للدكتور أسامة على مؤتمره العظيم الناجح اللي كل سنة بيبقى أنجح من اللي قبلها، وأشكركم جدا.